Hi, my name's Liz Bradley and I'm one of the oncology dietitians at Addenbrooke Hospital. I'm going to be talking to you today about nutrition and kidney cancer. So just to give you an overview of my talk today, I'm going to try and do a little introduction as to what is good nutrition. Then we're going to talk a little bit about coping with treatment side effects, a little bit on altered bowels, and then a small bit on exercise at the end. So to start with, good nutrition really depends on where you are in your cancer journey and where you are with treatment, and how well nourished you are. So if you're losing weight or underweight or struggling with your eating because of treatment side effects, then good nutrition is very different to someone who is well, healthy, stable and not having treatment. So this is the Eat Well plate. This picture demonstrates what we consider healthy eating for the general healthy population. So as you can see from this picture, roughly about a third of your intake should be made up of fruit and vegetables. About a third should come from starchy carbohydrates, and then the rest should be made up of a mixture of high protein foods, so things like meat, fish, eggs, beans, and then a couple of portions of dairy a day, so something like milk, cheese, yogurt, and then a little bit of foods that are high in fat and sugar. However, if you're underweight or struggling with your weight and your eating, then you might want to have less of things like the fruits and vegetables and more of the other foods, so more of the foods that are high in fat and sugar, because they will help you to get more calories. So next on to vitamins and minerals. I get asked lots of questions about multivitamins and whether people should take them or not. I think that if you're eating a good, healthy, balanced diet, then you're probably getting all of the nutrition and the vitamins and minerals that you need, and you probably don't need to take one. However, if you're struggling with your eating or you feel that you really would like to take one, then I think it's worth taking a general over-the-counter multivitamin that's not more than sort of roughly 100% of each particular vitamin and mineral. I don't particularly advise taking a single vitamin or mineral supplement because they tend to give very high doses of each thing. I think if you feel that you're lacking in one particular vitamin or mineral, then it's worth discussing this with your doctor or with a dietitian. So next on to nutrition support. So this is advice for those people that are struggling with their weight and their eating. If you're losing weight or underweight or really not eating much, then you will be less likely to do so well with your treatment, have less energy and are at more risk of infections. So the advice I'm going to come to next is to try and help you to avoid that. So coping with treatment side effects. So the most common side effect that we hear is poor appetite and fatigue, and they can really affect your eating and your weight. So this advice is to try and help you to overcome this and prevent weight loss. So trying first of all to be positive about what you're eating is really important. If you're not managing very large portions, then it's probably a good idea to try and eat more often than normal. So rather than going for 3 big meals a day, it might be easier for you to manage 3 small meals and 3 snacks in between. Milky drinks can also be really helpful during this time. They're very nourishing and are an easy way to get extra calories and extra protein. It's also a good idea to make use of friends and family that are happy to help you with your cooking and your food prep. And it's also good to use things like convenience food. So if you're really struggling with food preparation, you're feeling tired and it's hard to make your own meals, then it's perfectly fine and just as nourishing to use things like ready meals or takeaways. So next on to taste changes. So these are quite common as well. Lots of people report loss of taste or changes in their taste, particularly things like meat. Often people say tastes different or metallic. If you're finding that your food tastes metallic, then there are some ways that you can try to overcome this. So first of all, trying to avoid using things like metal utensils and metal sort of cooking devices as well is a good idea. So you can do things like heating your food up in the microwave in a plastic pot instead, or trying to eat your meals with a plastic or wooden knife and fork instead of using metal ones can help. Marinating meats and sauces can also try and help to overcome this. If you're finding that you've just completely lost your taste and things taste really bland, then trying to make use of really aromatic or strongly flavoured foods is quite helpful. So things like extra chili, garlic, herbs and spices, they can all really make a difference during this time. Lots of people also report sore mouth, and if your mouth is very sore, then obviously it's more difficult to eat and you might want to then avoid those foods. Anything that is very sharp or strongly flavoured may be difficult for you to eat during this time. And mouth care is really important during this time, so plenty of teeth brushing and use of mouthwashes can be really helpful. If you're experiencing nausea and vomiting, then you're much less likely to eat well. A regular anti-sickness medication can really help with this, and it's definitely worth talking to your GP or medical team about this if that's a problem for you. Trying to take an anti-sickness tablet sort of roughly half an hour to an hour before you eat is probably the most effective time to try and have one. Also trying to make use of foods that are less likely to make you feel sick during this time is wise. So things that are cold don't smell as strong and they're much more likely to be tolerated. So trying to make use of cold, plain foods, things like cheese and crackers, snacks of things like olives, hummus and crisps and dips and those sorts of things can be quite useful during this time. So next on to altered bowels. So diarrhea is a common side effect experienced by people that are having treatment for kidney cancer. If diarrhea is a problem for you, then it's probably a good idea to avoid too much fibre in your diet. So try not to eat too much fruit and veg, certainly no more than the 5 portions of fruit and veg each day, and you might want to make one of those portions a smooth fruit juice. Try to avoid foods with skins, pips and seeds, because they will contain more fibre, and it's also a good idea to try and make use of the non-whole meal, non-whole grain options of your starchy carbohydrates, so things like white rice, white pasta, that sort of thing. It's also really important to keep hydrated during this time, so make sure that you drink at least 10 cups of fluid a day. And if you're finding your symptoms are very unmanageable, then it's also worth considering something like loperamide to help you to cope with the symptoms. You can talk to your GP, your specialist nurse or your doctor about this. If things are still a problem, then it is worth asking to see a specialist gastroenterologist for advice. So lastly, exercise. So we know that exercise is really beneficial for lots of reasons. It's really good for things like mood, fatigue, managing anxiety, as well as helping you to keep hold of your muscle mass. So it's something that we really promote here at Addenbrooke. If you want more one-to-one, more tailored advice, then you can also ask for a referral to a dietitian. Your GP or your medical team should be able to arrange that for you.